common misperception in manual therapy is that the neck is the neck. It is actually two pieces. The neck has the upper cervical complex, which is what I'm holding here, and the typical cervical vertebra that are below that. So we're going to focus on the motor control center of the body, most important joints in the body here. What are they? Base of the skull, occiput, C1 or atlas, C2 axis. Atlas axis, an OA joint. So here we go. The first thing we're going to do is what I call alternate OA, and I like for you to think about it as sub-occipitals because it's easier if you focus on it as sub-occipitals because you know where those little guys are. So we're going to think about the lateral sub-occipitals, getting our hands in the lateral sub-occipitals, our fingertips here, while we control the sides of the head. What's going to happen here with Everin in a second is I'm going to lean to my right foot, and when I lean to my right foot, I'm going to pull up on the side of the sub-occipitals on the right. When I lean to the left, I'm going to pull up on the left. Right, rhythmically left, rhythmically right, rhythmically left, rhythmically. If you feel a restriction, all of a sudden it doesn't want to go right, you hang out there. You may ask them for eye movements because that fires the optic nerve, fires the sub-occipitals, and gives you a little motion through there. Back and forth, don't hang out there too long. If it's not moving, don't force it, don't bulldoze that barrier. Back and forth, back and forth, back and forth like that. It's a fantastic technique. I made this up myself. I deserve a reward for this thing. Here we go. I'm going to put this right here. All right, so here we go. Coming in on the it doesn't matter where your fingers are on this thing, really. Just think lateral fascia. Pull it up to the base of the skull till you can feel the base of the skull and you're there. Start by leaning to my left. Notice how I actually have my elbows against my body and I'm dragging too. I'm dragging that tissue up as I lean to the left. Lean to the right, I'm dragging the tissue up. Lean to the right slowly, I'm dragging. And I'm also looking in there for that bone, that transverse process of Atlas. You'll finally feel that. On some people and some big bodybuilders, thick neck guys, you're not going to feel it. Don't worry about it. Just stay on the sub-occipitals. But eventually your palpation skills are going to get to the point where you can actually feel that transverse process of Atlas, and that's when the good stuff happens. So back and forth, back and forth. So let's say I have a restriction. Say everyone can only go that far when I come to the left. What am I going to do? I'm going to ask her to push her head to the right against me. 2, perfect. 3, she doesn't bulldoze past me. 4, 5, and relax. When she relaxes now, I take her back over there. Just keep doing it, jiggling it until it lets go. If it doesn't let go, come back later, another session, make it work in another session. Okay, OA, alternate OA, don't forget that. All right, next piece of this 3-joint complex is the OA joint. It has to rock like that. These condyles are real complex. We're not going to get into the biomechanics of the complex. Suffice to know that side bending rotation occur to opposite sides in the, at the OA joint. The most complex joint in the body probably. So we need to get this thing rocking back and forth like that. I've got a simple way to do that. So I'm going to come in, get my body weight low. Always keep your body weight low, center of gravity low. Get that belly out, sumo wrestler position. Pick up the head carefully, come under the head so that you're cradling it like this. Next thing I'm going to do, and this is odd, but do it anyway. You're going to put your left hand on the forehead, and you're going to act like you're just pushing their eyebrows down. Just act like you're pushing their eyebrows down, because that's actually what you're going to do. Here's the motion, and this is real important. Body weight low. You got a bowling ball in your hand, right? And now you're rocking it. You're just rocking that bowling ball back and forth, like notice how the hands stay still. I'm not doing this stuff. Back and forth, back and forth. So here we go. First of all, I'm trying to see how many double chins I can get out, Aaron. You can't pick the head up. If you pick the head up, it doesn't do any good. You're not testing away anymore. You tip down to the typical cervical vertebra. Pushing the eyebrows down, pulling up on the back of the head, rolling that bowling ball. and there's not a lot of movement. But notice how nicely her chin tucks. Sometimes you'll get a clunk, clunk, and that's a good thing. Clunkers, we like clunkers. That means that that OA joint's rolling all the way back on those condyles. Okay, so in neutral, she's good. She's been having, let's say she's having migraine. She's having headaches on the right side. So I've got to test each side. So I just side bend her a little bit to the right. You don't need to know this, but right now I'm testing the ability of the left occipital condyles to glide back on one another. In other words, I'm seeing if that joint works. I'm isolating the left side now, particularly if she's having left-sided migraines. Same thing, exactly the same thing, slowly up, and she doesn't go as far. She actually does go as far. Let's play like she doesn't. Okay, so here we go, and she doesn't go as far. I say, okay, look up at me with your eyes, please. Optic nerve, I say optic nerve. She tries to pull her head back against my resistance and relax, and I take her back to her new barrier. See now she's tucking. Take her to barrier, look up at me, and down, and tuck. Just jiggle it and make it work. Don't forget to do that. Back to neutral, and check in neutral. Still good in neutral. Now let's say it's the other side, same thing. Just side bend to the left. Hand on forehead, don't let the head come off the table. And tuck your chin. When she tucks, I just give it like 2 seconds of overpressure. Tuck. You don't have to use the tucking motion, but it's just helpful. So here's what it looks like in practice in real time. I come in and I'm doing this routine. I'm going to show you all this routine of these 3 segments in real time, just like I would do them in a session. But for right now, I'm just going to show you in real time what this looks like. First in neutral, tuck your chin. Checking in neutral, rocking in neutral, and I feel like it's okay, but I'm going to go ahead and test both sides. So then what do? Side bend to the right. Tuck. Tuck, feeling pretty good. Back to neutral. Now I'm going to do the opposite side, so I'm going to side bend to the left. Tuck. Tuck. Back to neutral, and that's it. Right? That's the OA joint. That's one of the most important joints in the body, as I said. Now we have to see what head rotation's like. How does the head rotate? You know, Atlas axis, 45 degrees. Even if you have a complete neck fusion, I have clients for years, 40 years of practice. I've had clients come in and go, oh, the neurosurgeon wants to fuse my neck, but I'll never be able to look in my rearview mirror again. Nonsense. You'll have 45 degrees of rotation to each side because there's no disc between Atlas axis, so you don't have to worry about disc problems. But you can get some problems with bone spurring, but that's not. Articular cartilage is pretty good. So this is all we wanted to do right here. What I'm going to do is I'm going to come in. There are a couple of ways to do it. I'm going to do it the simple way first, which is just bring the head and neck into flexion, which ligaminously locks all the typical cervical vertebrae so that when I turn it, it just turns the atlas on axis. That's all we're trying to do right here, 45 degrees. Atlas on axis to the left, and then 45 degrees to the opposite side. Simple, right, not always. So if it doesn't work like that, you got a hypermobile person, I have a feeling she may be a little bit hypermobile in the neck, then that ligaminously locking doesn't work. What I have to do is I have to come in, still simple, come in, just get your fingers on the side of the neck right here against this bone right there, and then you rotate it around, stabilizing here, right? Actually really easy. But let's do it the simple way first, and this is how I want you to do it if you haven't done it in practice before, any of these routines in practice, just do this. Okay, so here's what I mean by ligaminously lock. What is the ligament that ligaminously locks it? Nuchal ligament. So look how high she goes. She goes pretty high, but that's pretty good. I think I can lock it because I can feel that ligament tighten up. Okay, so now that I've locked all the typical cervical vertebra, all I have to do is just to rotate her head right and left 45 degrees and see if she has 45 degrees in both directions. So here we go. I'm going to the right first. Keeping the head in the same plane. You have to act like there's a pole going straight down through the head and through the neck. You got to rotate around that axis. If you get over here and you're doing all this stuff like that, you're not doing anything. Here we go. It's real simple. Look, notice how my elbows are out. And a lot of people who've had neck injuries either won't let you have their head, they won't let it go, or they try to help you, and you don't want them to help you. Look, she's really, real smooth, real easy. But let's say she is hypermobile, and so I'm just going to come in here with my fingers on the very top. Just think underneath the base of the skull, that's all. Just think sub-occipitals, don't get complex, don't make it fancy. Just get under there, and on the other side, just kind of get your fingers on the spine anywhere below that. So you're just bracing basically over here. And now when I rotate her, I'm just rotating this whole thing around. I can even do this with just my left hand as I come across, just grabbing that transverse process atlas and just rolling around. Notice how I go further than 45 degrees here? Because I'm really wanting to make sure this thing's working. Now the other side. Here we go. Well, a little bit of restriction here to rotation. Definitely a little restriction to rotation. Okay, gently turn your head to the right. 2, perfect. 3, 4, 5, and relax. One more time. And relax. Here we go. Good. Decompress, decompress. Anytime you have them in flexion or rotation, got to always decompress. After each routine, I do a little bit of that. So you've got upper cervical complex. In review, real quickly, we start with alternate OA, OA, and then atlas axis.